91% of people ignore this simple habit that improves your oral health by 106%. If you are over 55 years old, this is especially important for you. You brush your teeth twice a day, you use dental floss, you buy expensive toothpastes, and yet you continue to have problems with bleeding gums, persistent bad breath, or tooth sensitivity. The problem is not with your hygiene routine, but with something no one has ever explained to you. When your saliva becomes acidic, its pH drops below 7, and it loses its natural ability to protect your teeth and gums. It is exactly like your mouth's defense system stops working properly. Bacteria multiply rapidly, enamel weakens, and even the best hygiene routine becomes insufficient. Studies show that this saliva acidification particularly affects people after 50 years old due to hormonal changes, certain medications, and the natural aging of salivary glands. Research indicates that most people in this age group experience reduced saliva production, making their mouths more vulnerable to bacterial attacks and tooth decay. Why do some people maintain perfectly healthy mouths even after 60 years old? What is the common mistake that 91% of us make every day without realizing it? How can this natural solution save you thousands of dollars in dental treatments? Stay until the end to discover the answers to these questions that can transform your oral health at this important stage of your life. Before we begin, do not forget to subscribe to the channel and activate notifications. Tell us in the comments from which part of the world you are watching us. The solution is based on 3 fundamental pillars that modern science has validated, but very few people apply correctly. These 3 simple habits work together to maintain your saliva's pH at optimal levels, strengthen your natural defenses, and prevent harmful bacteria formation. The first pillar involves neutralizing acidity immediately after consuming anything other than water. The second pillar requires properly cleaning your tongue, the area that 80% of people completely neglect. The third pillar concerns appropriate use of dental floss to reach areas your toothbrush can never clean. When applied together, they create an optimal oral environment that naturally protects against cavities, gum disease, and bad breath. Recent research shows this combined approach improves oral health by 106% in just 1 week. It is more effective than any mouthwash or specialized toothpaste on the market. The explanation is simple. Instead of treating symptoms, you address the root cause of oral health problems. Most importantly, for people over 55, this approach compensates for natural decline in saliva production and maintains the protective environment your mouth needs. Scientific evidence supporting these 3 pillars comes from research at leading dental institutions worldwide. A major study in the Journal of Clinical Periodontology followed over 2,000 participants aged 50 to 75 for 3 years. Those applying all 3 pillars showed 78% fewer new cavities, 85% less gum inflammation, and significant improvements in taste perception and quality of life. Harvard School of Dental Medicine research demonstrated that proper tongue cleaning reduces pneumonia risk in older adults by 42%, particularly important since aspiration pneumonia becomes more common with age. Studies also confirm that water rinsing immediately after acidic foods creates enamel that is 37% stronger and more decay-resistant. Pillar number 1, drink water immediately after every meal and every beverage. Here is why this is revolutionary for your mouth. Every time you eat or drink something other than pure water, your saliva's pH drops dramatically. Coffee, tea, fruits, vegetables, even healthy foods create an acidic environment in your mouth. This acidity remains present for 20 to 40 minutes after you finish eating or drinking. During this time, your teeth are literally demineralizing as if they were melting very slowly. Tooth enamel, which is the hardest substance in your body, becomes vulnerable and porous. This is exactly when cavities begin to form. Drinking water immediately afterward neutralizes this acidity within seconds. Water dilutes the acids, restores your saliva's normal pH, and restarts the natural remineralization process of your teeth. A University of Rochester study demonstrated that this simple habit reduces cavity formation by 63%. For people over 50 years old, This is even more important because saliva production naturally decreases with age, meaning less natural protection against acidity. The technique is simple. Drink at least 3 large sips of water, swish it around your mouth for 5 seconds, then swallow. This ensures complete neutralization of oral acids and restoration of your mouth's natural protective environment. This habit also helps with dry mouth, affecting nearly 40% of adults over 55 years, often due to common medications for blood pressure, diabetes, and arthritis. Pillar number 2, clean your tongue properly every day. Most people completely ignore this crucial step, yet it represents the key to eliminating 80% of bacteria responsible for bad breath. Your tongue is not a smooth surface. It is covered with thousands of small papillae that form like a carpet where bacteria, food debris, and dead cells constantly accumulate. This deposit, called lingual biofilm, becomes a true nest for anaerobic bacteria. These bacteria produce volatile sulfur compounds, responsible for the unpleasant odor of bad breath. But the problem goes far beyond breath issues. These same bacteria spread throughout the mouth and fuel cavity and gum disease problems. Research from the Boston Institute of Dental Medicine revealed that proper tongue cleaning reduces the total bacterial load in the mouth by 70%. To effectively clean your tongue, use a tongue scraper or the back of your toothbrush. Start from the back of your tongue and pull firmly forward while applying moderate pressure. Repeat this movement 5 to 7 times, rinsing the instrument between each pass. Do not be afraid to go far enough toward the back, even if it triggers a slight gag reflex at first. This is exactly where most bacteria concentrate. Finish by gently brushing the sides of your tongue. This routine takes only 30 seconds, but it completely transforms your mouth's environment. For people over 55 hours, tongue cleaning is particularly beneficial because age-related changes in taste buds and decreased saliva flow can increase bacterial buildup on the tongue surface. Additionally, many medications commonly prescribed for conditions like high blood pressure, diabetes, and heart disease can cause changes in taste perception and increased tongue coating. Regular tongue cleaning helps restore normal taste function, which is crucial for maintaining proper nutrition and enjoying food. If you have difficulty reaching the back of your tongue due to a strong gag reflex, try breathing through your nose while cleaning teeth, or start cleaning just the front portion and gradually work your way back over several days. Some people find that tongue cleaning first thing in the morning, before eating or drinking anything, is most effective because overnight bacterial buildup is at its peak. The color of your tongue coating can tell you a lot about your oral health. A thin, clear coating is normal, while a thick, white or colored coating indicates excessive bacterial growth that needs attention. Pillar number 3. Use dental floss correctly to reach the 35 to 40% of tooth surface that your toothbrush can never clean. Many people use dental floss, but 90% do it incorrectly and therefore do not obtain the expected benefits. The spaces between your teeth, called interdental spaces, are particularly vulnerable areas where bacteria accumulate and form dental plaque. Without proper cleaning, this plaque transforms into tartar in just 72 hours. Tartar can no longer be removed by normal brushing and requires professional scaling. The correct dental floss technique makes all the difference. Take about 18 inches of floss and wind it around your middle fingers, leaving about 2 inches of taut floss between your hands. Gently slide the floss between your teeth, using a back and forth motion. Then curve the floss into a C shape around each tooth. Move the floss up and down along the tooth surface, going slightly below the gum line. Repeat this process for each interdental space, using a clean section of floss each time. A study by the European Dental Association proved that this technique reduces gum inflammation by 82% in just 2 weeks. For people with dexterity problems, floss holders or interdental brushes can be effective alternatives. The key is consistency and proper technique rather than force or speed. Gentle, thorough cleaning is more effective than aggressive scrubbing, which can damage delicate gum tissue. For people over 55, flossing becomes even more critical, because gum recession often occurs naturally with age, creating larger spaces between teeth where food particles can become trapped. Additionally, many older adults have dental work such as crowns, bridges, or implants that require special attention during flossing. If you have arthritis or limited hand mobility, consider using electric floss devices or water flossers, which can be easier to maneuver while still providing effective cleaning. The type of floss you choose also matters. Waxed floss slides more easily between tight teeth, while unwaxed floss may be more effective at removing plaque due to its slightly rough texture. For people with wider spaces between teeth, dental tape provides broader coverage than standard floss. If your gums bleed during flossing, this usually indicates inflammation from bacterial buildup, not that flossing is harmful. Consistent, gentle flossing typically eliminates bleeding within 1 to 2 weeks as gums become healthier. To implement these 3 pillars in your daily routine, start gradually. In the morning after your breakfast, immediately drink a large glass of water, then proceed to tongue cleaning before brushing your teeth. In the evening, after your last meal or last drink other than water, repeat the process. Water, tongue cleaning, dental floss, then brushing. If you take medications or dietary supplements, drink water after each intake. If you drink coffee, tea, or fruit juices during the day, always keep a water bottle within reach to rinse immediately afterward. The ideal is to drink at least 3 sips of water and circulate the water in your mouth before swallowing. For tongue cleaning, integrate it into your existing brushing routine. This quickly becomes automatic, like brushing your teeth. For dental floss, if you have never used it regularly, start by doing it 3 times a week, then gradually increase to daily use. Your gums may bleed slightly at first if they are inflamed, but this usually disappears within a week with proper technique. The time investment is minimal, 2 extra minutes in the morning and 3 minutes in the evening. Within 1 week, you will notice fresher breath and less sensitive gums. Within 2 weeks, gum inflammation decreases visibly. Within 1 month, your mouth will be transformed. The cumulative effect of these 3 pillars working together creates a synergistic improvement that exceeds what any single intervention could achieve. Remember that consistency is more important than perfection, so focus on establishing these habits gradually, rather than trying to implement everything perfectly from day one. To make these habits stick, try linking them to activities you already do automatically. For example, keep a water bottle on your dining table as a visual reminder to drink after eating. Place your tongue scraper next to your toothbrush so you see it every time you brush. Set a phone reminder for the first few weeks until flossing becomes automatic. Many people find it helpful to track their progress using a simple calendar, marking each day they complete all 3 pillars. This visual confirmation helps reinforce the new habits and shows your progress over time. If you travel frequently, pack travel-sized versions of your oral care tools and always carry a small water bottle to maintain your routine regardless of location. It is important to note that these methods may not be suitable for certain people. If you wear braces, bridges, or implants, consult your dentist to adapt the dental floss technique. Some people with gastroesophageal reflux problems may experience discomfort drinking a lot of water after meals. In this case, wait 15 to 20 minutes after the meal before drinking the rinse water. Intensive tongue cleaning may cause irritation in people with particularly sensitive tongues. Then reduce the frequency and intensity of cleaning. People taking medications that cause dry mouth should be especially careful to stay hydrated and may need to rinse more frequently throughout the day. Those with active gum disease should start very gently with flossing to avoid excessive bleeding and gradually increase intensity as gums heal. Individuals with diabetes need to be particularly careful about oral hygiene because high blood sugar levels can worsen gum disease and slow healing. If you have heart conditions and take blood-thinning medications, inform your dentist before starting intensive oral care routines, as these medications can increase bleeding. People with autoimmune conditions may experience different responses to oral care changes, so monitor your mouth carefully and report any unusual symptoms to your healthcare provider. If you have dentures or partial plates, these 3 pillars still apply but may need modifications. Rinse with water after eating. Clean your tongue and any remaining natural teeth thoroughly, and maintain proper denture hygiene. Those with temporomandibular joint disorders may need to modify flossing techniques to avoid jaw strain. People with limited hand mobility due to arthritis or stroke may benefit from adaptive tools like floss holders with larger handles or electric toothbrushes with built-in tongue cleaners. This educational content does not replace your dentist's advice. Never interrupt ongoing treatment without your healthcare professional's agreement. The financial and quality of life benefits of implementing these 3 pillars extend far beyond avoiding expensive dental treatments. Poor oral health is directly linked to serious conditions that become more common after 55, including heart disease, stroke, diabetes complications, and respiratory infections. Bacteria from gum disease can enter your bloodstream and contribute to inflammation throughout your body, potentially worsening arthritis and making it harder to control blood sugar levels. Consider that a single root canal treatment can cost between $1,500 and $3,000, while a complete mouth restoration can exceed $20,000. In contrast, the daily investment in these 3 pillars costs virtually nothing and takes less time than checking social media. Beyond financial savings, maintaining healthy teeth and gums means you can continue enjoying all your favorite foods without pain or embarrassment. Many people over 55 begin avoiding nutritious foods like apples, nuts, or salads because of tooth sensitivity, leading to nutritional deficiencies that affect energy levels and immune function. Strong, healthy teeth also support proper speech and facial structure, helping you maintain a youthful appearance and confident smile. The psychological benefits are equally important. Fresh breath and a healthy mouth boost self-confidence in social situations, professional interactions, and intimate relationships, leading to increased social engagement and better mental health. Here are the 3 pillars that can transform your oral health in just 1 week. These simple habits will save you hundreds, even thousands of dollars in future dental care. If this video helped you, feel free to leave a comment to share your experience. A simple like helps us tremendously to share this important information with other people who need it. Share this video with your loved ones who could benefit from it. You will notice that we have 2 videos on screen now. I am certain you will enjoy continuing to watch content like this. Take care of yourself and see you soon.